We need plain language communications because most of us haven't gone to medical school, so we don't know the terminology. We don't know what biomarkers, biologics. We don't know what SED rate, ESR, we don't know those terms. And so I think that we need plain language communication, and most importantly, providers and companies willing to listen. They need to build that trust. I think to build that trust, we can start there, because trust is the bridge between treatment and transformation.
Welcome. I am delighted to be joined today by Stephanie Wynn. Stephanie is a survivor, an advocate, a patient leader and educator. Stephanie, welcome. Thanks for joining me today. Can you introduce yourself briefly, telling us all about your story and your journey today? Why are we here?
Absolutely. Thank you so much for having me here on the podcast. My name is Stephanie Wynn. I am the founder of the Stephanie A. Wynn Foundation. I'm also a Crohn survivor. I was diagnosed with Crohn's disease in 2017 after going through 6 different diagnoses and losing 2 children. So I'm super excited to be here. We have at the Stephanie A. Wynn Foundation, our mission is really, truly to remove the health and financial disparities in communities that are underserved, who don't have access to quality healthcare or GI services. And so it's more than just bringing awareness to inflammatory bowel disease, whether you have Crohn's disease or ulcerative colitis. Our goal is really, truly to help these patients navigate the healthcare system simplistically without the overwhelm. So that's a little bit about me.
Yeah, thank you, Stephanie. That's such powerful stuff. When I said you were a survivor, I didn't quite realize how much you had survived. So thank you so much for sharing your story. One of the things you said there, I think we're both in agreement that lived experience is so important when trying to understand a condition. So with that in mind, what do you want people in the pharmaceutical and healthcare industries to know about being you? What is it like to live with your condition on a daily basis?
So living with this condition is just it's uncertain. You just don't know from one day to the next. So one day you might be good. The next day you just never know. But for me, it's an everyday battle because I'm always fighting against something that's fighting against me. So whether I have fatigue, whether I'm just tired, of going to the bathroom multiple times a day, you just don't know. And so one of the things what I would want pharma to know is that people who we serve aren't just statistics, we or check boxes on the form, if you will. They're real people that we're serving, and they're dealing with a chronic condition that affects, every part of their body. And so whether it's physical, emotional, or financially, this condition just affects every part of their life. And many patients in marginalized and vulnerable communities, they don't get access to the same level of care. Let's just start there. They're not given treatment options. And so I think that what's happening, that they're giving instructions or being told what to do. And there's a lack of trust there. And I think that a lack of communications put specifically. And I think while providers are telling these patients what to do, I don't think that they're not giving these patients options. And there's a serious cultural disconnect there. So if we're going to improve outcomes for these patients, I really, truly believe we need a culturally responsive care representation in clinical trials for the Black and brown community, because we're not there at all. And then not even given an option to participate in the clinical trials. Let's start there. And then we need plain language communications, because most of us haven't gone to medical school. So we don't know the terminology. We don't know what biomarkers, biologics. We don't know what SED rate, ESR, like we don't know those terms. And so I think that we need plain language communication. And most importantly, providers and companies willing to listen, they need to build that trust. I think to build that trust, we can start there, because trust is the bridge between treatment and transformation. And so that's what I would want them to know. And just to add to that, patients aren't given options when they go to see these GI doctors. And so if there's a patient that has insurance that's underinsured, or a patient that doesn't have insurance at all, the pharmaceutical companies have a patient assistance program, copayment assistance. The doctors aren't telling them that. So they're having to pay like out of pocket thousands of dollars. I know, because I was that patient.
Yeah.
No options. It wasn't until the nurse pulled me outside to tell me that, hey, when you go back to see the doctor today, ask him about assistance for paying for your infusion, because there's help. And so I think a lot of times, I don't know if it's because providers are so busy. I get it. But in your initial visit, that should be one of the things that is discussed. And that goes back to one of the social determinants of health.
Yeah.
Can you afford you know what I mean? So that's one of the things that I wanted to let pharma know about.
Thank you, Stephanie. I'm sorry to sort of slightly talk over you there. You've raised a number of points that I think are really, really interesting. So you started by saying that your condition treats everybody differently. And I think that is something that's really important to understand. And then you went on to talk about health equity and the Black and brown community, and how communication and trust is lacking. So I want to come back to that, but I'm going to start by just asking you another question about what it's like to live with your condition. And the reason for that is I want to know, is it difficult sometimes to explain to a healthcare provider and anybody who doesn't know what it's like living with your condition? Like sometimes I guess you can feel fine, and sometimes you can feel absolutely horrendous, and it's the don't know that's so difficult. So you don't know how you're going to feel on a daily basis. And I guess that affects your mental health, and it affects your whole life really, doesn't it? Because you don't know how you're going to feel when you wake up in the morning. Is that something that you hear a lot from your community?
Absolutely. Some of the patients that come through our IBD Patient Navigator Program, they don't even understand the diagnosis.
Yeah.
For example, one patient had a CT scan or a diagnostic testing. They were told that she has ileitis, and she said the only option was surgery. And she was like, I think I'm just going to get my ileum removed. I'm like, what? So it's things like that. And so, and you asked the question of, do you feel like it's hard to describe to providers your symptoms? Absolutely. Because what shows up, the symptoms that show up for Stephanie may not show up the same way for you. So I may just say, hey, I have this stomach issue. I don't know why I'm having stomach pain, and that's it. I don't elaborate. It's just pain. Well, you might say, hey, listen, I'm having cramping. There are some signs of bleeding in my stool. Like, you go into full detail.
Yeah.
And I think it's because there are just culturally, that's where we are right there. Like, we just need this pain to stop.
Yeah.
So what happens is, I was there because I said it, my stomach is just, I remember saying, I just feel like I have to go to the bathroom all the time.
Yeah.
And I'm cramping and I don't have energy. Okay, just take these 2 Tylenol and call me in 2 days if the symptoms get worse. I didn't know at the time that I should have been asking other things because I didn't go to medical school.
Yeah.
My background is in finance, not medical.
Yeah.
So,
it's very hard to know what you don't know, isn't it? And therein lies the problem. And the other thing that you touched on there was the lack of representation in clinical trials and therefore drug development of the black and brown community. And you talked about a lack of trust, poor communication. And I know your program has been set up to help people understand and navigate their way through the healthcare system. But talking about trust, is that when you say there is a lack of trust, do you mean that people from your community don't trust the pharmaceutical industry? Or do you mean that the pharmaceutical industry doesn't trust you? They don't trust what you're telling them?
No. So when we talk about historically, and that's a great question. Historically, we've been historically there is a lack of trust due to, I don't know if you've ever heard of the Tuskegee experiment. Historically, we've been even here recently, like we could talk about COVID-19. Patients who are on immunosuppressants are being told to take a vaccine that suppresses the immune. Like we could start there, but culturally there is distrust because when we're not educated we're told one thing, but then it ends up being something else. And so I think it's very important, when I talk about the trust, I mean, what is it that I'm believing you as the doctor to know what you're talking about to better my health outcome, right? So I think to regain trust, and that's with anybody, whether it's in the pharmaceutical company, whether it's in your daily life, the communication has to be there. And do you really understand what you're getting ready to do, or what are you going through? I mean, you have the options. Again, we go back to trust. It's two-way communication. One.
I was going to say communication is coming, and problems with communication is coming out loud and clear from everything you've said so far. With a condition like yours, it must be quite hard to A, communicate effectively your symptoms, and B, actually for the healthcare providers to understand what you and your communities are telling them, and then make a diagnosis and make a healthcare plan. And like you say, if there is trust there, then you feel more willing to work together towards an end goal. But without that, it's a bit difficult, isn't it? And I guess that's where your program comes in. So you're helping your community to communicate more effectively so that they're true, and to understand what they're being told more effectively, so that, everybody has a better outcome.
Yes, because like you said, like even with me, like, and we can even go past the culture, like the historically, with the Tuskegee experiment, we can talk about, for my example, in 2017, I saw 6 different doctors. So I was told several different things. You have Crohn's colitis, you have ulcerative colitis with Crohn's involvement, you have this, you have that. Like, I didn't know what it was like. And so then I lost a daughter. You told me it was an anomaly, to find out years later that it was Crohn's disease. Yeah. So again, as you can see, the misdiagnosis, the not being heard.
Yeah.
And so that alone and being overlooked.
Yeah.
That's why, I became a certified patient leader, and that's why we fight to give these patients just the knowledge that they need just to advocate for themselves and to, like you said, get an understanding of your condition.
Yeah.
Because a lot of times patients, they're diagnosed with, whether it's diabetes or high blood pressure, you hear the doctor, but it doesn't hit until you get home and you let it sit for a while. And now you're like, okay, what did they say?
Yeah.
Right?
Yeah, completely agreed. I think we can all relate to that.
Yes.
You hear something that you weren't expecting to hear, and it's just like, well, now I can't hear anything ever again. Taking us back to clinical trials, how can the pharmaceutical industry reach out to the underserved communities? That's a huge question. And I'm not expecting you to come up with an answer in, 5 minutes or whatever. But what sorts of things can the pharmaceutical industry do to reach out and connect with underserved communities?
Well, first, I think that is a great question. However, I just, due to how we've been treated in underserved communities and populations and what's going on in the world today, I think that from a standpoint of the provider, first of all, let's start there, because the pharmaceutical company and the provider need to have that we need to start there. There's a lack of communication there. Then the provider's office need to offer or provide this information to the patient. Because you just coming into underserved community saying, hey, we have a clinical trial. We've done that before with the Tuskegee experience. Like, we've been there. We're not going to do that again. I think what it is that we need to educate patients. For those who want to get involved in a clinical trial or clinical research, should be titled clinical research instead of a trial. Let's start there.
Sorry, that is fascinating. I have never heard that before. It's the trial thing that's putting you off. And I can, now you've said it, I can totally see that. That's really interesting. Yeah. Sorry, I've stopped your train of thought now.
No
Carry
worries. on. But the clinical research, because you have to keep in mind, these medications aren't working because for the Black and brown community, because we're not showing up in these research trials. Like, we're just not there. And so I believe that if the doctor provide the patient with the option to partake in this research to see if there's something that can help them, or we look at it from a holistic perspective. You mentioned mental health before. Let's build this team so that this patient can get mental health and wellness, get diet and nutrition. Because now you see the brain and gut connection. And so I think just having an option, because right now when we look at the numbers, you see that they're based off of European white males, these medications. And so that's why a lot of patients are failing them that look like me.
Well, and me, to be honest. Yeah, there's no women in research.
And women, like, so if you're using a male DNA, I get it. But the science doesn't lie when it comes to how something affects Stephanie A. Wynn versus the lady down the street, right?
Yeah.
It tells you there's a difference there, right? And so I believe that before the pharmaceutical companies can go into these underserved communities, I think there needs to be some education, because you want to give patients, again, options to choose whether they go into clinical research, not a trial, because after that trial is over, then what? Are you just going to leave these patients to, so we have to really be careful when we talk about, clinical. And I mentioned this in Navigating IBD, a 6-week blueprint for better gut health. That's an option to patients. But a lot of patients don't know that going to, through a clinical, I'm going to call it research, going through clinical research is an option to them.
Yeah.
It's not offered.
Yeah.
It's almost like, okay, you're cooking dinner tonight. What are we eating? You just have the plate, but there's nothing else. So what are we eating? Just the plate?
Yeah.
And so, when you look at it from that perspective, I think that we need to educate these patients more about that as an option for their treatment plan. If all other options have failed, all other biologics, JAK inhibitor, all of those things have failed the patient.
You've said some
or prior to.
Sorry.
Let me correct that. Before you even fail, let them know that that's an option in the event that these medications do not work. You have an option to join.
So you've said a number of really fascinating things there. So thank you. So you've said that people in your community don't know about clinical research, and they don't know that it could be an option for them, which I think is really important. And we do hear that globally, that people just aren't aware of it. Mm-hmm. In Europe, and particularly in the UK, it is becoming a bit more usual that exactly what you've said there. GPs, so general practitioners, will mention research to patients a bit more routinely. But again, only if they know about it themselves. And there's another disconnect there, that sometimes the doctors that you're talking to, they don't know about the research either. Yes. And I think you also touched on the fact that people working in the industry aren't aware of the history in the Black and brown community with the healthcare industry. And I thought you said something incredibly powerful when you said it's not going to be as easy as just talking to us and saying, hey, join this. It'll be really useful for all of us, because there's that underlying distrust because of historical things that have happened. Mm-hmm. And I think what you're saying as well is the answers are all around clear communication, are around education, and are around, frankly, treating each other as if we are equal human beings, with respect. And I think that's an incredibly powerful message. So thank you for sharing those sorts of things. Now, you mentioned your book and your Navigator program. And I'd like really to finish up by giving you the opportunity to talk about those two things. Just let us know what they are and what you've done.
So, yes, thank you so much, Helena. Thank you for that. So, going on this journey, I started documenting my process. I started documenting the things that I did not have. And at first, the book was going to be about just my story. And then September of last year, I was like, no, it needs to be a tool, if you will, to help those who are navigating inflammatory bowel disease, whether you have Crohn's disease or ulcerative colitis. And it needs to be in a short amount of time, because sometimes, I don't know about in the UK, but here in the US, it may take you 6 months to a year to see a GI doctor, right? And so what I wanted to do was provide a tool for IBD patients. And so my book, Navigating IBD, a 6-week blueprint for better gut health, is just a practical and emotional guide for newly established or patients who are already diagnosed with Crohn's disease. And it was created with the patient and the caregiver in mind. It also helps them understand what's happening in their body. So you have symptom tracker, you have a meal tracker, you have a medication tracker, right? And so and at the end of each chapter, there are reflection questions. So how are you feeling today? What was it that you ate today that made you feel a certain way? And I talk about in these chapters, denial, death, distractions. And the reason why I talk about those is because going on this journey, I lived all of those things. I was in denial when I got my first diagnosis. I experienced the loss of 2 children. I went full term in the first pregnancy, lost that baby. Went 5 months in the second pregnancy, lost that child. And so I was really in denial because I didn't want this condition. I mean, who wants a chronic illness? Who wants to talk about not being able to not go to the bathroom, who wants to talk about losing their bowels or whatever. So it's more than just a book. It's a tool. It's a journal, if you will, and it's a resource. I include, real world tips of like how you can approach your doctor's appointment in a simplistic way. Sometimes patients don't know that they can ask questions in a doctor's appointment. So you have to really be right now what we're experiencing in healthcare here in the US. If you go in person to a doctor's appointment, it's 15 minutes. If you get your physical, I think it's maybe the max 30 minutes. But if it's a regular appointment, it's 15 minutes max. If you're doing telehealth, it's 10 minutes, 30 seconds.
Yeah.
So you really have to be in preparation for your doctor's appointment. At least have 3 questions ready to go. Don't go in there with 20 because you may not get any of those questions answered. Go in there with 3 questions.
Yeah.
Ask your questions. And if you can get one of the 3 answered, you're done a good job for the day. You just have to reschedule and have the other 3 answered. I mean, I think that's where we are with healthcare right now, but you have to have a plan. And this guide, Helena, is not just for, in this guide, we give them topics like the medication, the biologics. What is a biologic? What is a biosimilar? What is a MRI with contrast? What is a CAT scan? What does that mean?
Yeah.
You hear all of this language, you hear these acronyms as you're going through this journey. And I think in order for us to have better health outcomes, Helena, the patient has to be educated.
Yeah.
And if the patient is educated, then we're going to see better health outcomes because now they can manage their condition with the understanding, hey, my iron levels are very low. What are some options for this?
Yeah.
Right? My inflammation markers are a little bit high this month or this quarter. What are we doing about that?
Yeah.
My GFR, my kidney function is a little low. How can I get this in a normal range? Most patients don't know to ask that because we didn't go to medical school. So what I did, I started researching my labs. What does this mean?
Yeah.
We're privy to all of this. And I asked my doctors, hey, let's go through all of the labs that are out of range, that's not normal. Tell me, what are we working on with this? What are we doing with this? So that's how Navigating IBD was discovered and formed, because it's everything that I wish I had going through this journey, Helena.
Yeah.
Thank you for asking that.
It really sounds like you are absolutely practicing what you preach there, because that is an educational tool for people living with your condition, so they can understand all the medical terminology that they may come up against. It's an educational tool for the physicians as well, because you're asking people to keep a record of their health and triggers and things. So again, you've literally just summed up everything that we've been talking about there in terms of open and honest communication and having some way to facilitate that. So thank you so much for sharing about your guide. It sounds absolutely brilliant. How can people get hold of it?
So they can go to navigatingibd.com and grab a copy. It's navigating NAVIGATING. I as in Ivan, B as in boy, D as in David.com.
Perfect.
Navigatingibd.com.
I'm sure people who need it will get there, because it really does sound like it's an absolutely useful thing to have. So thank you, Stephanie, for sharing your incredible story and being exactly living your truth in that. You have been so open, you've been so honest, you've been so clear with everything that you've wanted to say. I've loved meeting you and speaking with you. Thank you so much.
And can I leave your audience with something
Please
really quick? Thank you. So if you're living with inflammatory bowel disease or supporting someone who is, so maybe they have Crohn's disease or ulcerative colitis, I want you to know this: you're not alone. You don't have to have all the answers to take the next step. You didn't do anything. This is not your fault, right? Your story matters. Your voice matters. And healing doesn't always happen at once. It's not going to happen at once. You got to put in some work. But sometimes it's just one meal, one prayer, and one brave decision at a time. Thank you all so much for tuning in. Thank you, Helena. I appreciate you.
Thank you.